Hello, my name is Ivan Chumakov, and today I would like to tell you about my project focusing on how exercise can help with chronic low back pain resolution. Before I dive into the details of the project, let's add a bit of context. What do we know about pain and why it is important? It serves adaptive function of survival and inner warning system. There are different tolerances and severities of pain, but what is the origin of chronic pain when the clear trigger is gone, but the pain persists? That's what we're trying to know. Some statistics before we go further. More than 30% of Americans alone live with some form of chronic pain. Those 30% comprise 116 million people, and it is more than people with cancer, heart disease, and diabetes combined. Hope I delivered the point that there is a lack of knowledge and a huge demand for chronic pain solutions. Pain is the number one reason why people come to see a doctor. Annual societal expenses are huge. The amount of hours people spend studying pain in medical schools is less than 15 for the whole duration of studies. Current treatments, unfortunately, are not as we expect them to be. They lack efficacy, have dose-limiting side effects, and involve addictive substances. That's why it's really important to continue studying pain and finding new solutions to battle and treat it. Since drugs are not working, the exercise is what works the most for managing chronic pain. What is the connection between pain and exercise? Why exercise? It is one of the only few treatments which consistently shows positive effect of chronic back pain, and it is usually recommended as a first-line treatment. First, let's try to understand what is the connection between exercise and pain. On the gene level, after and during exercise, some genes activate and some shut down, causing the inner response. It is an underlying cause of pain resolution. But the catch is that no one knows what exactly causes pain elevation. In order to answer this question or get closer to the truth, I performed bioinformatics analysis associating pain changes with gene expression, bearing in mind my hypothesis that there is underlying mechanism responsible for pain elevation, presumably inflammatory response, based on the previous research. In the end of the analysis, I indeed saw a higher enrichment in inflammatory response, indicating that is one of the major drivers of pain changes, though not the only one. Unfortunately, it is never the case in the research that answering one question doesn't arise three more. Therefore, the hypothesis for the future studies is that exercise induces acute inflammation, leading to drastic spike in it, which then causes more active and severe downregulation of the same pathways, leading to stabilized levels of inflammation. Meanwhile, people who do not improve never experience this drastic spike, making them permanently having slightly elevated inflammation, but never the norm. In conclusion, active biological processes underline pain improvement in chronic low back pain patients, and active downregulation of inflammation is the major contributor. Lastly, to end this presentation, I would love to introduce this great quote mentioned by Robin Sharma, Canadian author of The Monk Who Sold His Ferrari. If you don't make time for exercise, you will probably have to make time for illness. Thank you.